Now that the PROAIS project has come to our community, my children can lead a healthier life. We now have a chance, thanks to them.
Hello, my name is Norm Brown, president of the W.K. Kellogg Foundation. Among the many rewarding tasks I'm involved in through the foundation, my job today is one of those I treasure the most. And that is the tremendous pleasure of reporting on one of the many success stories that we've been fortunate enough to be a part of. As you may be aware, the Kellogg Foundation at any given time participates in over 200 programs in developing countries. The most successful of these seem to share common elements, and proudly, these are the same elements that reflect the philosophy of W.K. Kellogg and his inspiration for this foundation. These include, first and foremost, total involvement of the people, a sound plan for continued growth, and careful cooperation among the agencies which may be participating. These include the community, various levels of government, sometimes a university, and funding sources. Our focus today is on a program in Brazil, in the northeastern state of Ceará. The program is all about integrated health action, and it's called PROAIS, a name derived from its formal Portuguese title. PROAIS is emblematic of the Kellogg philosophy. It addresses in a very innovative way several problems that much of the developing world faces: infant mortality, disease, poverty, and malnutrition. Our message today includes the underlying conditions leading to these problems, the story of PROAIS, and a discussion of those factors contributing to its successes thus far. We hope you will leave with an understanding and an appreciation of the efforts being made by the people of PROAIS. Their dedication is leading to a dramatic solution, decreasing the problems faced by much of the world.
In order to understand the need for PROAIS, it's important to look at the underlying problems. Brazil occupies the greatest portion of South America, a landmass even larger than the contiguous United States. While there's considerable wealth concentrated mainly in the central and southern regions, the Northeast is quite different. The problem is poverty, often chronic, persistent poverty. From this, all other problems seem to follow. In the state of Ceará, many people migrate from the harsh conditions of the interior to even worse conditions in city slums, such as Conjunto Palmeiras, on the periphery of Fortaleza, the state capital. Before PROAIS came, medical facilities and health education were usually sparse or non-existent in both urban and rural communities. Mobility to access these services was also limited. PROAIS was created to address these problems. Dr. Sylvia Baumfim, professor of gynecology.
Because of the extreme poverty, infant mortality is one of the highest in the world. 1 out of 10 children dies before reaching age 5. The emotional impact on the family is tragic.
Infant mortality is considered the most precise social indicator of how bad conditions are in any given region. The primary cause of death is diarrheal disease and dehydration. The root of the cause is poverty. Dr. Marilyn Nations, medical anthropologist with Project Hope.
Sometimes it's difficult to know how very serious the problems are here, how many people are really dying. Sometimes we have to use very unusual sources of information, such as the grave digger, the woman who makes death robes, or the coffin maker.
Tell us how many children have died here in the last month.
In the last month until today, 4 children died in our village, 2 of them from diarrhea.
These underlying problems of poverty and high infant mortality revealed an obvious need to make health care available to outlying communities. A look at the early history of PROAIS will explain how this was undertaken.
In 1975, my late husband, Professor Galba Araújo, was medical director of the maternity hospital here in Fortaleza. He observed many rural women coming to the city for relatively simple obstetric and gynecological problems that with even basic health resources could have been solved locally. With the help of community leaders from Guayuba, a village 30 kilometers south of Fortaleza, Dr. Galba took the first steps to set up a birthing and healthcare center.
We owe a lot to the insight and inspiration of Dr. Galba. The initial goal of PROAIS was to reduce the rate of maternal and infant mortality in the village of Guayuba. This was accomplished by providing appropriate training and technology to the people. It required us to change many of our ideas about modern medical practice because these practices weren't always accepted by the local culture. In working with the people, the model that finally evolved was successful.
Within a year, the program was so well received, other community leaders and mothers were visiting Guayuba and Dr. Galba, requesting the same opportunities in their villages. The following years witnessed an evolutionary growth and a model in teamwork among the people, the university, the government, the Kellogg Foundation, and other international organizations. PROAIS was begun. Today, over 10 years later, PROAIS has expanded into a broad network of birthing centers. Integration of human resources is the heart and soul of the entire structure. Integration of administrators, formal health care professionals, community leaders, and traditional faith healers. In its area of activity in the state of Ceará, there are about 32 primary care units or clinics. The number varies as new communities enter the program and older ones become autonomous. These birthing centers provide primary care to local residents and referrals to 3 secondary care regional hospitals. All of these rely on the maternity hospital at the Federal University in Fortaleza for tertiary care. This is PROAIS, an integrated program of health action. The success of the program depends on a strong administrative foundation to keep the network together. This is the location of the PROAIS headquarters at the Federal University in Fortaleza. This central location in the state capital assures that local, state, and federal resources will be efficiently managed. The next supporting element in the structure is the academic program.
PROAIS operations are linked to the university through the Integrated Teaching and Assistance Program, or IDA. This is an extension program that enables the university to combine academic study with practical fieldwork in the communities. People who operate PROAIS fall into 2 basic categories: formal and non-formal.
Formal personnel include professors and students from the schools of medicine, nursing, dentistry, pharmacy, and education, as well as practicing professionals serving in the field. Non-formal personnel include traditional birth attendants, health agents, and faith healers living and working in each community.
We call it interiorization. That is, expanding our academic activities to address the needs of the people out there, beyond the city limits.
There is a constant recycling of people through our teaching and research programs, all integrated with the rural reality. At all levels, integration is necessary. The maternity hospital here at PROAIS headquarters is the tertiary care unit, the hub of the wheel.
Secondary care units offer assistance and backup for the primary units with full-time staff to treat the more serious cases.
The primary care units are located in many counties across the state. That's where we really reach the people at the local community level. Sometimes it's an exciting ride, yes? This is Guayuba, where the first birthing center was started in 1975. We are going to start here because it has the typical components you'll find in all primary care centers. It's here where the integration of resources is so evident.
Primary care units are developed and supported through the integration of 4 entities. The Community Association determines the needs, provides a building, and most of the funding for operations. PROAIS provides the professional staff and technical support, as well as university students in training. The government provides medical supplies and some funding. Local personnel handle all operations and through home care activities are linked to the community as a whole.
The clinic typically has 5 components: an outpatient service, family planning, supervisor's office, kitchen, and a birthing center with pre- and postnatal care. This is a very special part of the birthing center, the delivery room. And this is the very famous Dr. Galba chair, a very good example of modern technology adapted to the traditional custom, the birthing stool. Women used to sit right here to deliver. They grab a rope that comes from the ceiling to push. And there you can see the adaptation. This substitutes the rope where she can grab and push. And here the baby is caught by the traditional birth attendant. On average, there are 50 births a month in this clinic. The mothers usually stay only 24 hours to have their babies, then they go home. This is a vital tool of operations, the clinic ambulance. Transportation is a big problem for these people, and these old things get a workout. In addition to the basic facilities of a primary unit, there are sometimes variation. This is a daycare center next door to the clinic. It has a classroom and a kitchen. The teacher is hired locally and the mothers assist her. Another variation of some primary units is a government-funded health post joined to the clinic. They are supervised by PROAIS. They do outpatient care, dentistry, immunizations, and family planning. Another variation to this Conjunto Palmeiras unit is this women's activist group. In the poor slums, so near the capital city, we find some pretty common frustrations. Men have trouble getting jobs, which sometimes results in abused and battered women. These women are doing something about it through community demonstrations.
In order to operate a primary unit, it takes people. The role that PROAIS plays is to provide formal personnel for on-site training and supervision, as well as a clinical practicum for university students.
One of the larger clinics is here in Lagoa Redonda. It has a full-time doctor and a nurse who supervise everything. PROAIS uses the Way to Health card and has developed other systems for tracking and reporting medical histories, data gathering. The laboratory is outstanding for a rural clinic and very well equipped. We can run many of our own tests right here. PROAIS does the overseeing while the community people do the work.
Wherever there's a clinic, there's a community association behind it. These are the people who set the dynamics in motion. They identify the community's needs, secure a facility, and raise the funding. All along the way, PROAIS is there for advice and technical support, but the association makes it happen.
Doutor, esta unidade é mantida não com o dinheiro do programa. Essa maternidade, essa clínica, ela é mantida com o dinheiro da comunidade.
Okay, he says they are not dependent on the project for money. The community supports the clinic completely.
The government is the third supporting entity of the primary units. While its participation is limited due to competing priorities, it fully endorses the PROAIS network. This non-government community leader describes the situation.
I
am the president of Lagoa Redonda Community Association, and I can tell you that we have to depend on ourselves. Our national social security system helps a little, and the state government does what it can. But the important thing is for us to municipalize. That is, for the community to support its own clinic.
Integrated health action is most exemplified in the local personnel at the community level. This is where PROAIS learns as well as teaches. This mother with her sick child is going to Dona Aurea, a faith healer. Faith healers are long-established pillars in every community.
This is Dona Aurea. She's a healer in the Afro-Brazilian tradition. Dona Aurea, quem é esse orixá aqui? Esse aqui?
Esse?
Não, aqui.
Mãe Maria.
Mãe Maria.
Ela é curadeira, é parteira. Eu curo em nome dela. Então, depois eu despacho o soro.
Ótimo. Dona Aurea said that this is an Afro-Brazilian healer. Mamãe Maria, she's a healer and a traditional birth attendant. And she uses her to pray on children. After praying and asking for her strength, she then gives oral rehydration therapy to the children.
Later, we were able to see Dona Aurea's healing session.
Deus é Espírito Santo. Trabalha com perfeição. Aqui se acha o soro. Aí você faz num litro d'água. Freva.
We respect and we learn from the traditional art of the faith healer.
Community health workers like Socorro are so important to this community. She represents the new generation of healthcare consciousness. And these women are another bridge between traditions. They are the traditional birth attendants. It's very much to our advantage to work together with the TBA and the faith healers because they're highly respected and they know a lot that is scientifically useful. Also, they're very natural about healing, which we can learn from.
Vocês acreditam nisso? Uma parteira fazendo.
Can you imagine that? A midwife giving a pap smear?
Porque ela confia no trabalho dela.
In order to make the PROAIS network function, it is necessary to coordinate the talents of many people. This is done through tactful and dedicated training. Training is a continuous process throughout the PROAIS network. At the university level, it involves the formal staff of practitioners, supervisors, and students. At the local level, informal personnel are selected by their community associations to participate in the program. Being selected carries a certain prestige and a lot of enthusiasm.
Our main goal is to make replicable models of modern biomedicine adapted to traditional healing.
Many things are taught to the new trainees, but the essence can best be expressed and remembered in the acronym GOBI, used by many international health organizations. G stands for growth monitoring. O is for oral rehydration therapy, one of the revolutionary breakthroughs of our century. B stands for breastfeeding, and I is for immunization. GOBI, simple procedures of healthcare delivery that have given millions of people a new sense of security, indeed a new life.
Why is it so important to teach these things? Some people look at poverty and overpopulation and they throw out their hands and they say, well, there are so many poor people, maybe it's better to let them die. But you know, there's something very interesting about overpopulation and infant death rate. International studies show that when fewer babies die, fewer are born. Family size tend to stabilize when infant death rate drops. And so it would seem smart to keep children alive and healthy, yes? And so we do our work.
In the training sessions, students also learn to take blood pressure, to give cancer prevention exams, to give pre- and postnatal care, to assist in delivery, to teach family planning, and much more. When they return to their clinics, they know that they have gained useful knowledge, and they know that PROAIS is there to support them.
We've developed a risk referral system that tells us exactly when a woman is doing fine at the basic primary health care level and when she has complications and needs to be referred on to the secondary or tertiary care level. Our parteras, like Reginalda, are so good at what they do that 90% of the time her diagnosis corresponds exactly with that of the doctors. Tudo bem?
Tudo bem. Tudo bem, tá ótimo. Pode ter o bebê dela aqui. Assim ela quer.
We simply adore them.
The number of patients who benefit from the clinic or who we reach through home visits and community gatherings like this is increasing all the time. But we are still reaching only about 51% of our target population. This is because of long distances to travel and transportation limitations. But our integration process is working at all levels from the community to the university.
Program of Integrated Health Action. What does it mean? We have modified a system of medical education that is often too specialized, and through this extension program, we have integrated. We are now more than a university, united, where the whole is greater than the sum of its parts. We have integrated health training and health services with the basic cultural beliefs and practices of the people.
This is the story of PROAIS, a program of integrated health action which arose from a specific need in a specific place. There are several key factors that have influenced the development of this program and should be shared. Cooperation. At the administrative and academic level, it involves the university, the state and national government, and international funding agencies. At the community level, it involves the community association, the staff, and the people. Interiorization, that academic curricula be responsive to the realities of the people. Data gathering, from the coffin maker and grave digger, to the way to health cards, to the supervisor's reports, to the PROAIS computers, progress must be mapped and documented. Risk referral system, through careful diagnosis and efficient networking, to know where to go for help, from primary to secondary to tertiary care. Municipalization, the clinics in each community strive for autonomy and self-reliance.
O programa, dentro dos seus objetivos futuros,
Now, our future objective is to collaborate with the government in municipalizing clinics in the areas where we work. We intend to be an alternative model of primary health care in a way that can be replicated on the local level, as well as in other regions internationally. We know this is possible from observing our successes in other states where our activities are being practiced.
In the many countries of our world, we sometimes see the patriotic enthusiasm for development turn into the politics of profit. Problems follow the classic curve of a few leaving the many behind. Are these impossible problems to remedy? We believe they are not, but it takes commitment. Fortunately for our world and for new generations to come, there are models of a new age well in the making. We hope that this program will be an inspiration to governments and institutions all over the world to prosper from their people by nurturing them, by creating opportunities for them to grow and develop. People helping people to help themselves. It makes all the difference.